Now, your company, 4DMedical, has developed an alternative to nuclear medicine-based VQ called CTVQ. Can you talk a little bit about what CTVQ is and what sort of clinical gap it fills?
Yeah. So for several years now, we've had a commercially available, validated product called CT ventilation analysis, which shows in detail the function of the lungs in CT without any inhaled radio tracers. So we take a traditional, as Trishul pointed out, inspiratory, expiratory paired CT, and by comparing the two and simply performing a mathematical analysis on the data within the images can provide a detailed map of ventilation inside the lungs. Ever since the first day we showed that to people, the immediate question that would follow was, what about perfusion? When will you have perfusion? And so we're really excited that just recently, just about 2 months ago, we received FDA clearance for our perfusion technology, which is pairs with our ventilation technology. So, I think the most important thing for people listening to or watching this podcast to understand is that we take an absolutely traditional CT scan that can be acquired on any CT scanner, not using any injected contrast, inhaled contrast, not requiring any unique protocols that are difficult to carry out. In fact, we can perform this retrospectively on inspiratory, expiratory CTs that may be 5 or 10 years old. So you can actually look at this longitudinally and essentially produce, with only a computer analysis of those images, a very detailed study that provides both qualitative and quantitative information of exactly how the lungs are working, both from a ventilation and perfusion perspective. And so the patient undergoes no additional evaluation. The patient has no exposure to injected contrast or radio tracers. It is simply an analysis.
Now, Tricia, you've worked with CTVQ and you've received some of this data. What do you see its value as being, and how do you think it could change patient management?
A couple fold, Brian. So when we think about the nuclear medicine market, it's a $1 billion market. Greg has mentioned there's a couple limitations with standard nuclear medicine tests, namely price, obtaining rare new isotopes that you have to inhale and inject, time to do the scanner. And also the other component is that we share these scanners with our cardiology colleagues. And so a lot of these tests are the same sort of devices that we utilize to look at cardiac stress tests. And so there's a large demand for these devices and very few centers that do these tests and very few nuclear medicine physicians that read these tests. Almost every emergency room in every hospital in this country has a CT scanner. And as Greg mentioned, those CT scanners in the past 25 years can produce this study. And so if we can expand access, it can greatly reduce the time it takes to obtain these studies and also improve overall care and availability and affordability of these tests. So it has the potential to really change the overall market and more so improve how I, as a pulmonologist, see patients, where I'm not waiting a month to get a scan back. And we're not waiting 2 months to do a surgical resection or an endobronchial valve or even a lung transplant. And so in terms of thinking about cost, time, and overall patient experience, the opportunity here is pretty large.